Every changing color of leaf is beautiful, and every changing situation in life is meaningful. So no matter how difficult the challenges may be, when we spread our wings of faith and allow God's spirits to lift us, no obstacle is too great to overcome. Welcome, ladies and gentlemen, to Dr. Tapaswini's Corner. And that's me, and I work as a head and neck oncosurgeon. Each of us in our lives have a share of disappointments and sorrows. But what really matters is what we choose to become under pressure. A piece of coal or a piece of diamond. So a coal blackens everything that it touches, but a diamond shines quietly, casting a beautiful spell and gets polished under pressure. Such is the story of our today's breast cancer survivor, Ms. Neelam Kumar. You are a best-selling author, have written more than 10 books, a TEDx speaker, corporate trainer, writing coach, Pinkathon ambassador, and a cancer crusader, to name a few. You've been honored with the prestigious Nargis Dutt Memorial Trophy in 2017, the Inspiring Woman Award in 2018, Glenmark's We Wash Woman of the Year 2018, and the Karami Chakra 2019. But this list is just 1/4 of your achievements. I mean, the list is so huge, we can't really get it on this program. Credits and hats off to you. Welcome, and it's indeed a pleasure to have you on the show today.
Thank you so very much, Dr. Tapaswini. Honored to be here, to be interviewed by a doctor who is quite iconic like you.
Thank you so much. Right. So the first time you were diagnosed with cancer, and that was in 1996, correct?
Yes.
And the second time was in 2013.
Yes.
So looking at 1996, you must have been really young at that time.
I was totally Alice in Wonderland, because I was just 35, 36. My husband died suddenly.
Okay.
And that grief just tore me apart. And so I do not know medically how you diagnose it, but yes, I was quite overwhelmed by the pressure of being a single mother, a single woman, and making my way ahead in a man's world. And that was in 1996. And to make matters worse, yes, I got my first breast cancer.
So did you not experience any symptoms?
Yeah, it's quite funny because I was so busy trying to live life. There were too many things to be done. That when I felt the little hardening on my left breast, I just thought I would get to it later. It was so tiny, and I had to go to work. I was working in India's largest steel plant. So it was a man's world there also. So I had to prove myself. I had to change my label from poor widow to excellent professional. So I was so busy doing that, and a mother and a father to my kids. So when I realized that the lump is becoming a little uncomfortable, what I did now in hindsight, doctor, when I look at it, it was a mistake. I went to a friend of mine who said that she was a sort of a doctor, you know. She looked at it and she said, no, it's a moving mouse. Don't worry about it. So one month went by. So by the second month after that, I was having some symptoms. Yes, weakness and everything. And that's when I actually followed somebody's advice to show it to a surgeon. So I went to Bokaro General Hospital, and I was diagnosed with cancer then.
Okay. So what was the time lapse between your detection of the lump and the diagnosis?
So doctor, the first time I was an amateur. In 2013, I was a veteran. So in the first cancer, the time lapse was 2 months, 2 deadly months. And when I became a veteran, in 2013, I think it was just 2 days.
Okay, okay. So the second time that you were diagnosed, that was in 2013.
Yes.
So you were quite experienced, and you would have also realized what mistakes you had done in the first. Was that again as part of, an accidental finding that you again found?
So it's a very interesting story, something that maybe medical practitioners will not believe in, but
Okay.
because I am a very, very imaginative thinking person, the next morning I was going to Pune to meet my mother, and right that night I had a dream that I had to get my right breast checked. Now I do not know where that dream came from, but knowing my intuitiveness, so I took myself to Tata Memorial Hospital.
Okay.
So within one day I was diagnosed, and I think the treatment started.
So did you go around seeking opinions, or you trusted the first place that you visited?
No, you mean the first time? First time I was a babe in the woods, absolutely not. I think I went to a lot of friends, lot of advisors, and I did every wrong thing possible for 2 months.
Okay.
And the second time, I did not get a chance to take second or third opinions because I was very fortunate to get the top man in Tata Memorial Hospital. And then he did the surgery, of course, and then I moved on to Hinduja Hospital, where chemotherapy and the radiation. So I was very fortunate that way.
So what do you see in the clinician? Do you, which makes you decide or have faith in that particular doctor? Was that the compassion or the empathy, or was that the team that you saw and you liked it and you said, yeah, this is the place where I want to be treated?
Absolutely, doctor. I'm so passionate about this question. I think, a doctor has to treat me like, not like a machine with broken parts. He or she has to treat me like a human being with an intelligent mind. And the first thing my doctor said to me is, it is a problem, but don't worry, it is our problem. And we will get through it together. So I said, you are my man, doctor.
So you struck the chord there.
Absolutely, yeah, because I had also just read the book, Faith, Medicine, and Illness. So I passed on that book to him and I said, this is how I want to be treated. I want to talk a lot, I want to question a lot, and I want to become a co-partner in whatever you are doing to my body. And he agreed. So that's what a doctor should be, like you, with great bedside manners.
When we talk about breast cancer, a lot of surgical treatment revolves around removal of the breast. So do you think losing one's breast is like losing one's womanhood?
Dr. Tapaswini, thank you for asking this question.
Yeah.
Because again, I feel very strongly about this issue. A woman is not only her breast. Unfortunately, our media society equates a woman, especially the fashion world, the movie world. There's so much of titillation around the breast. So it's high time the breast was taken away, taken from its position of being a titillating organ to a nurturing one. So yes, it is very traumatic when a woman's breast is removed, because in many ways women identify womanhood with that. But I was very fortunate. There was only lumpectomy done for me the both times. But had that been done, I would have said my identity is still there. I am not my physical body. I'm not my breast. So I wish women who go through mastectomy would approach it that way.
Correct. So I think the message we should go across is, if you come early, there is a high probability and possibility of preserving. And in some situations, yes, even in the advanced stages, in some situations, also we can preserve the breast. So it's important that there should be a lot of awareness among people. Now, the choice of treatment. So do you think the choice of the treatment also gets influenced by a profession?
Absolutely, doctor. I think urban women who are professionals, who are
Right.
more social beings, who are more out there and have
Okay.
the means, they would
Uh-huh.
definitely ask for a breast reconstruction.
Oh,
And
yes.
I think age also matters a lot. And I think doctors today are smart enough to ask that question. In the earlier days, I think it was just taken away. Whereas, I think many rural women do not know about that choice. You talked about awareness. So that's my mission in life, that all this awareness about early detection, about the choices that you have for your own body, to
Correct.
speak up boldly and demand those.
Absolutely. Yeah.
That's my mission in life now.
And the other thing that women have to stand up for their own rights, because we get patients in
Absolutely.
our clinic where the woman is not allowed to make her own decision. It's the family, it's
Um,
the husband who's going to ultimately say what procedure is to be performed. So
right.
what I feel is that the Indian woman should stand up for her rights. She should be able to
Absolutely.
express herself, what her
Absolutely.
requirements are like, right? So
Absolutely.
did you also undergo chemotherapy?
I did, doctor, but before I go to that, I would like to add to what you are saying. That's what you said is a social evil. A woman's voice is totally suppressed. Woman doesn't have a right towards her own body. So she
Correct.
becomes just a doll or something in people's hands. I had a lady who was from the villages. She was in her 60s or 50s. And she came to me and told me that her husband had thrown her out of the house. And I said, why? So she said, because I have been infected by cancer.
Okay, that's a sad
Very
story
sad.
of Indian woman. So
Yes.
we were just talking about chemotherapy. So you underwent
Yes.
chemotherapy. What
Yes.
is the social stigma? Do you think that losing hair, again, what we were talking about, losing breast. So when it comes to hair loss, it's almost like a social stigma. So what is your take on this?
So I think every woman is very attached to her hair.
Mm.
Overnight, I turned from Rapunzel to, Dr. Spock of Star Wars, and it was traumatic. But I decided to use it as an opportunity to spread a bigger message. So it is at that moment that I went up on stage without hair and I gave a powerful motivational talk
Wow.
about men whose masculinity was in danger if they would not take the woman inside their homes to get their cancer screening done, and for the women to speak up for their right of getting early to the cancer detection center.
Yeah, but then this is this hair loss that we talk about often is something which is inevitable. It's a price which is paid by all the
Right.
patients on this treatment. But then,
Yes, but then sorry, but there's a wonderful side to it, doctor.
yes,
When the hair comes back,
yeah,
it is curly, it is thick, it is
okay.
glossy, and you get to, experiment with so many other styles.
Wow, that's lovely to hear. That's what is called optimism. So if you
Yes,
learn to face these problems with a smile and with a positive attitude, it may not
absolutely,
change the problem, but it can change the way one goes through it. So that's
absolutely.